how this technology gets applied to the healthcare sector. And healthcare is a very broad topic. What you are about to see here are our final 5 teams. And what we have told them is that they have 10 minutes to do their presentation. They will receive, if I'm not mistaken, a 2-minute warning, which Annie will come on over and give them a 2-minute warning. And then, essentially, when time is up, if it's up, she's going to do the fist like this, like time is up. Then, right? Okay, good. And then we're going to move into the Q&A session, and we're going to have our current chair for the Center for Leadership Ethics, Mr. Doug Zanes, who is going to ask the 3-pronged question. And we negotiated and decided that instead of only allowing them a minute to huddle and respond back and forth, we want to give them a little bit more time. We're really generous. We gave them 2 minutes. So with that 2 minutes, and they're going to take the microphone, they're going to kind of exchange and responding one by one. It's going to be pretty intense. It's going to fly by really quickly. We have asked all the teams to sit outside here, outside of Berger, so that there's a sense of fairness. But once that first team comes in and presents, they're going to kind of return to the audience. What we'd love for all of you to do when these teams come in and we introduce them is give them a very warm round of applause. We have a tremendous panel of judges here that have been, for the most part, with us the entire day. Some dropped in towards the very end, but we're really excited. So without further ado, I want to hand it over to my colleague here, Professor Fricke, who's going to introduce himself and then also offer a few other details. Michael?
I'm Professor Fricke. That's my introduction. Yeah. We're super excited to have you guys here. We love having a packed house for these teams. And so, as Professor Melendez said, please be super supportive of them. This is a really stressful day for them. They've already gone through a super intense round last night of Q&A that was very difficult. They gave a big presentation this morning, and they're back now to do their final round presentation. And we have an incredible mix of teams here in our final round. We have one Canadian team, one team from New England, one team from the Southeast, one team from the Midwest, and one team from the nation of Texas. And it's a good mix, my hometown. So it's going to be great. The first team, I'm going to invite them to come in. Concordia, come on in, folks. Concordia University.
It'll come on a second. This is your designated timekeeper here.
I'm going to give you a 2, I'm going to give you a 1, and I will cut you off at time. For the 2 minutes, I'll give you a 30 seconds. Imagine a world where human life has totally been destroyed. Humanity has abandoned the planet and left in large Starliner spaceships while they wait for humanity to be able to live on Earth once again. It's not until an AI robot named Eve comes to the planet searching for life that do humans learn between the power of determination, goodwill, and love how to save their world. Well, this hasn't happened because it's the plot of the WALL-E movie, but what has happened is that AI technology like WALL-E and Eve are here today and ready to change our world. Hi, I'm Juliana, and I'm here today with my colleague Sophie, and we're Virtue Vision Consulting, here to see you succeed.
So we're here today to evaluate and identify the potentials of applications of AI in the healthcare sector for the purpose of value creation. And when we're doing this, we're going to look at your key stakeholders, the potential gains of investing in AI in healthcare, the legal implications of AI and integration in healthcare, and we have to keep in mind throughout this presentation, what are the ethical implications of this investment? And so before we start, we need to look at our ethical dilemma.
Now, there's an ethical dilemma when it comes to AI. Yes, AI can present itself as friendly robots like WALL-E, but it can also be inaccessible, hard to understand, and borderline scary. Yes, AI can improve efficiencies and outcomes within the healthcare sector, but the implications of data bias, transparency, and privacy make it so that there is hesitancy in its use.
So first, we're going to look at your stakeholders. And when we think about our stakeholders, we have to think about two kinds of stakeholders. Your internal stakeholders that are directly impacted by the decisions you make, and your external stakeholders that have kind of a waterfall effect from the decisions you make and how you decide to apply them. And so when we look at your key stakeholders, we have you, the private equity firm, and your investors, followed by patients, medical practitioners, and regulatory bodies. And so now that we've looked at your stakeholders, before we go into a legal and ethical analysis, we really need to make sure that this is a sound investment to make.
Now, we're going to start by addressing the market potential for AI in healthcare, where the United States is expected to see the highest growth. The key considerations we need to keep in mind here are that there is a positive relationship between healthcare expenditure and economic performance, as well as the fact that the majority of AI-driven innovation occurs within the United States. Therefore, this needs to be the scope of your investment. Now, when we talk about AI applications in healthcare, what do we mean? Well, there are three that are the most permanent, and that's health tech. So this is your services, your management software, could even be ChatGPT. We also have biotech. So this is pharmaceuticals, clinical testing, trials and such. And lastly, medtech, more so therapeutic devices and medical technology. And your investment possibilities need to fall within these applications. Let's look at the state of the US healthcare industry. Let's say Wally needs a tire change and wants to make an appointment with his primary care provider. Well, let's start with the scheduling. This can take a long time, weeks or even months, due to the fact that 50% of US physicians believe they are at capacity. Next, you have the appointment, but your face-to-face time with the physician is cut short due to the fact that 56 million people are not seen a year by doctors due to administrative tasks. Next, you have to go for additional testing, further delaying the time it takes to get answers to your concerns. And maybe after that, you have to go to the pharmacy or you need treatment that may or may not even exist. Lastly, the follow-ups. Specialists, appointments, prescriptions, this can be confusing and time-consuming. Therefore, as a firm, you really need to focus on solving these healthcare pain points through AI investments. Now, what's really important to keep in mind when we look at the financial perspective is the fact that both the technology and healthcare sectors present opportunities. When we combine the high growth nature of the technology sector with the defensive and permanent demand that exists within the US healthcare system, what we see is an unparalleled opportunity for portfolio diversification across all three applications. Therefore, it's an investment opportunity you cannot pass up.
And so now that we know that we should be investing in AI in healthcare, how do we do this and what regulatory considerations do we need to make? And so the first thing that we need to know is that within your investment scope in the United States, there's no real regulation around AI, but there is regulation around healthcare. So for example, you have regulation between the patient and provider communication, you have regulation for your drugs and your medical equipment, and you have regulation around the quality that patients of care that patients should be receiving. And so when we think about the lack of regulation around AI, you need to develop an internal regulatory framework for your investments. And following this, when we look at what regulation has passed, in the EU, you have the first regulation on artificial intelligence that categorizes risk into three different categories. Unacceptable, which is a threat to persons. High risk, which is your current product safety laws kept in place with disclosure on AI. And limited risk, which is complying with transparency, making sure the consumer knows that AI is being used. And so when you think about these categories, you should be prioritizing your high to limited risk investments. And so now that we know the legal implications aren't, that the regulatory isn't really there for AI, we need to look at ethics to make sure that we're properly protecting your stakeholders.
Now, we talked about the ethical dilemma that exists around AI, and this is no different when we talk about healthcare. Sensitive information, and honestly, matters of life or death. So again, the main considerations we need to know are the implications of data and the implications of the model. This is where the fundamental concerns about AI use stem from. Therefore, in your investment framework, you need to consider this and put in protections when it comes to this regard. However, these implications can change, but what doesn't is ethical theories. Let's look at some. First, utilitarianism, acting in a way that produces the greatest amount of good for the greatest amount of people. Now, when it comes to health tech, it's really a wide variety of healthcare applications versus biotech being a bit more niche and medtech being more technical. Therefore, we would recommend health tech. Next, Rawls' theory of justice, acting in a way that produces the greatest amount of good for the least advantage. Now, health tech doesn't directly address equity or accessibility, whereas biotech and medtech do. But when we apply that veil of ignorance under Rawls' theory and say, who is the true least advantage? We would say it is those with untreatable or rare diseases, therefore investing in biotech. Lastly, Kantian ethics, acting in a way that should be replicated as universal law, bringing back those data and model implications and concerns. When it comes to biotech, there are large concerns around biometric data, medtech, large concerns around culpability and fault analysis, and when it comes to health tech, it is easier to abide by data privacy and maintenance standards. Therefore, we would recommend a health tech investment.
And so when we think about your investment, how do you make sure your investment remains ethical throughout its life? And so with this, you should be looking at the impact multiple of money that considers the scale of the social good that you've resulted from each dollar invested. Where you look at the scale of people facing a problem, your solution, and the economic value of solving this problem, and the adjustments that have to be made accordingly. And so when you calculate the impact of your investments, you're able to look financially at the social good you created. And so when we look at your options, when you consider ethicality, your timing of entry, your regulatory risk, and your impact potential, we can see that you should be moving forward with health tech as your primary investment.
Now, let's reflect back on the WALL-E movie, where when humans and robots finally worked together, they were able to turn a ravaged planet into a paradise. So our strategy for you is going to have you working together with AI in order to set the tone for innovation, not only at your firm, but within the healthcare industry.
And so we're proud to present to you Generating a Healthier Tomorrow, a 4-year strategy to invest in AI health tech companies to create value financially and socially. Throughout this strategy, we're going to walk you through your new investment process where you've integrated ethicality and social impact into your investment process. So first, let's prepare to invest. And so when we prepare to invest, first thing we have to be doing is preparing an ethical investment framework with 3 pillars: security, patient first, and impact. Security is all about your data protection. How are you staying HIPAA aligned? How are you maintaining your data? What are you doing to protect your data? When we think about patient first, does your patient know that they're using AI within their treatment? Do they have the ability to opt in instead of opt out? And how are we creating a positive impact?
Now, when we look at the impact potential, we have to ask ourselves key questions under health tech. Is this technology going to improve health, improve care, improve access, and improve data best practices?
Next, we're looking at investing in health tech.
So we've addressed 3 different companies that fall under 3 different themes. When we look at these companies, we have to look at the one that has the best round, the highest impact potential, the best data considerations, as well as the fact that it's patient first, which would give you Strive Health, kidney care systems that can help with diagnosis and treatment plans.
Next, we have to integrate due diligence. So with this, you'd be looking at the current legal atmosphere, what the governance framework for the investment company looks like, and also the ethical frameworks that they have in place. And so when we look at an impact analysis for Strive Health, you'd be looking at metrics such as reducing dialysis crashes and hospital readmissions.
Now we're going to optimize. So let's start by looking at value creation. So here we know that there are many different kinds of value creation strategies that you can do as a PE firm. For Strive Health, we would look at scaling, and we would look at strategic partnerships. We recommend you hold your portfolio company for 4 to 7 years, aim for a 3x return on your capital, a 20% baseline IRR, as well as establishing recurring revenue.
And so lastly, we're going to calculate the impact of your investment. So when we look at 37 million US adults who are estimated to have kidney disease and reducing those hospital readmissions that are coming in at $13,000 per hospital admission, and we adjust for the population within access to Strive Health, we'd be creating the social good of saving $1,300 per kidney patient in the US. And so by integrating ethics into your investment, just like WALL-E, with the power of determination and goodwill, you have created financial and social value in the US and globally. We thank you, and we open the floor.
So now for the Q&A section. Doug Zanes, the chair of the advisory board for the Center for Leadership Ethics, will be asking the questions tonight.
This is a 3-part question.
Yes.
Finish the question. Why is there an algorithmic bias in healthcare data sets? What are the potential consequences of an algorithmic bias in healthcare? And how can fairness be established in healthcare with generative AI such as ChatGPT by utilizing the open science approach?
So when we look at current bias in data sets, there's two things that we need to be looking at. So the current data that we give the current data that we are giving data set, the current data that we're giving models right now is biased not only because our medical practitioners have a bias within their care, but also due to a lack of diversity when it comes to that care. So when we think about underprivileged communities, such as for us in Canada, the First Nations up north have less access, there's less their data on their diversity, on their medical care, therefore less understanding on what their medical problems look like.
When it comes to helping avoid this bias, this is where practitioner review as well as the data sets play a huge role. This is where we spoke about model evolution as well as data set evolution. You need to be constantly looking at the parameters and the evolution of your model to catch any different gaps or biases that are happening.
And so lastly, when you're feeding new data into your model and you're considering that model evolution, you need to think about the diversity of the data that you've put in and how that model is having that evolution and how you're testing the model throughout its parameters. Thank you.
All right. Thank you, Concordia University. Okay, we're going to move right along. Let me open the door so they can come in. Okay, our second team presenting in the final round, representing the Central Region, Boston College.
I'm going to be your guys' timekeeper. I'll give you a 2-minute warning, and a 1-minute warning for the 10-minute presentation. For the 2-minute answer, I'll give you a 30-second, and I will stop you guys.
Okay, perfect. Thank you.
Oh, perfect.
Hi, everyone. My name is Adam Hassan,
And I'm Aditya Venkat.
and today we'll be talking about the implications and applications of generative AI in healthcare and your investment portfolio.
So before we dive into all the nitty-gritty details of this investment, first let's understand exactly how private equity has been involved. Headline after headline after headline after headline just shows us that private equity is gutting America and getting away with it.
With this being said, we believe we need to ground any potential investment in ethics. So the ethical framework we chose was Immanuel Kant, who believes that people may be used as a means as long as they share in the ends. In this case, we view people, the stakeholders, as the patients and healthcare providers. Kant also speaks about the fact there needs to be a respect for autonomy, in which each individual has its own worth and dignity. Finally, Kant's famous quote that counsels of prudence are always subordinate to morality, in which logic will always be below ethics. So, for our presentation today, we'll first begin with an overview of the private equity industry in healthcare, our current investments. We'll then pivot to the current landscape and future of AI and specific applications of generative AI in healthcare today. Aditya will then talk about potential synergies from a potential investment in AI in the healthcare industry. We'll return to Immanuel Kant, and then finally we'll end with important considerations along legal, ethical, moral, and financial lines.
So let's just first orient ourselves in the right way to find out what private equity's involvement in healthcare looks like. Private equity as an industry is a profit-motivated industry. It's all about making money. But historically, when you involve this in healthcare, this means long-term mortality rates go up. Increased costs are put on patients. There's a lower quality of care and staffing shortages because you cut employees to save money. So as the private equity investment in healthcare continues to rise up to over $200 billion in 2021, we want to make sure that we try and understand what investment should look like. We see two possible ways of doing this. Number one, invest directly in companies that are developing medical AI. And number two, purchasing medical AI for current healthcare holdings. But what does AI look like right now? Right now, there are three prominent AI chatbots. Number one, there's ChatGPT. Number two, Google's Bard. And number three, Bing's chatbot. But they're pretty elementary. It's about text generation, information searches. Some of them can create pictures, which are pretty cool. But they're not sophisticated enough to actually solve medical problems. So this means that we're looking to AI for the future.
Currently, there's a large movement on Capitol Hill to regulate generative AI. In fact, the CEO of OpenAI, Sam Altman, the company behind ChatGPT, even testified before Congress arguing for the regulation of AI. As we know, AI is currently a completely unregulated industry, whereas the healthcare sector is arguably the most regulated industry in the US. We believe a dangerous precedent could be created when you meld an unregulated industry with a heavily regulated industry like healthcare, and patients' lives are at stake. So, returning to Immanuel Kant, AI is clearly the future, but how can we adopt a prudent approach to our healthcare investment? We know that the margin for error in healthcare is simply too thin. These are patients' lives at stake. Therefore, we believe that patients and people should be the priority. So, for a potential investment, we believe in instituting ethical guardrails based on a Kantian framework of weighing the means versus the ends. So now we'll pivot to some specific applications of healthcare, of generative AI in healthcare. The first we looked at was preventative care. As a private equity firm, you should definitely take note of this because we know that misprevention is costly. In fact, according to the CDC, 90% of the $4.1 trillion in annual healthcare expenditure is due to people with chronic illnesses and mental health conditions. Therefore, preventative care is key to preventing chronic health conditions and thus optimizing costs. We also looked at the application of telemedicine, generative AI, and telemedicine in virtual health. With the onset of the COVID-19 pandemic, the use of telemedicine has skyrocketed, up 766% since the beginning of 2020. ChatGPT can serve as an online symptom diagnoser for historically underrepresented people who don't have access to healthcare. For example, Ativ Mohatra, a Harvard MD, explored ChatGPT's application as an online symptom diagnoser. Using ChatGPT was able to identify specific illnesses at a better rate than actual physicians and traditional online symptom trackers like WebMD. We believe this has applications for people with limited access to healthcare in the United States, the elderly, the uninsured, and for people with remote access to healthcare who live in healthcare deserts. Basically, in the United States, we know that 80% of people lack adequate access to healthcare, so generative AI can help improve patient outcomes for them. Finally, the most practical application we looked at was clerical work and productivity. We know the healthcare industry is document heavy. Physicians spend about 30% of their time simply entering patient data into portals. This has serious implications with the US Department of Health and Human Services finding a nationwide shortage due to professional burnout, due to simply clerical work. The result, more time spent documenting and less time spent with the patient. The solution, generative AI. One such company doing so is Abridge, which describes themselves as a super intelligent sidekick dispensing suggestions to improve care. Basically, Abridge provides automated solutions to clerical overload, recording summaries of a patient's visit, generating a billing plan and treatment plan. It's actually currently implemented at the University of Kansas and University of Pittsburgh Medical Center, where over 1,000 physicians are using it. So with that being said, we'll now transition to synergies from AI in healthcare.
With all these amazing applications of AI to healthcare, how do we actually derive value from them? Those are the synergies. In preventative care, the baseline idea is that we see improved health outcomes through lower costs, lower hospitalization rates, and an early detection of risk factors. In fact, the World Health Organization says if you detect early, you can improve your chances of recovery from over 30 to 50%. In the telemedicine and virtual health space, the basic idea is improved access to healthcare and healthcare equity. Like Adam said before, 80% of the United States doesn't have adequate access to healthcare. And if we can improve that, we improve patient convenience and make it more cost-effective for doctors and patients across the US and potentially the world. Finally, in the clerical work and productivity section, the basic notion of Kant is to improve the humanity in everything. And if we can increase the doctor-patient interaction, we accomplish that goal. We can improve doctor fatigue by not bothering them with all the menial clerical work. We can improve waiting times for patients because I've waited for 2 hours at the doctor's and it's just not fun. And finally, we can lower the cost for doctors and patients, which is really the primary concern of private equity firms. So how does this still fit into our broader notion of Kant? Just as a reminder, these are our three main facets. Number one, people may be used as a means as long as they share in the ends. A lot of data is going to be collected and put into algorithms and models. So yes, we might be treating people like data points, but at the end of the day, they are a means to a broader end that allows them to achieve better healthcare goals. Number two, respect for autonomy. We are trying to make sure that individuals maintain their own worth and their own dignity by increasing the patient-doctor interactions. Essentially, we're trying to make healthcare more human and more dignified. Finally, counsels of prudence are always subordinate to morality. It might sound really complicated, but all it's saying is that money cannot be the sole primary motivator for healthcare or for private equity companies. All decisions must benefit the patient and the doctor.
So before we make our final recommendation, we have some important considerations when it comes to generative AI's applications in healthcare. The first is hallucinations. Hallucinations are basically the tendency of generative AI models to produce inaccurate outputs with almost 100% confidence. If you take a look at this example from ChatGPT. The issue with this is that, as Dr. Gregory Ator spoke to, in medicine, we can't tolerate hallucinations, especially when human lives are at risk. The next thing we looked at was model bias. Model bias is basically the exhibition, perpetuation, and amplification of human biases by AI models, often due to the flawed data sampling, which leads to over and underrepresentation in a data set. So imagine there's a model for predicting breast cancer rates, and it was trained on primarily white patients. This would make it an inaccurate model for predicting breast cancer in Black patients. The result is that implementing biased models in healthcare can have serious implications for not only the quality of patient care, but also just making accurate diagnoses. We also looked at healthcare discrimination. So imagine, based on your health data, a model predicts you can have a 75% chance of being diagnosed with a chronic illness. Can insurance providers turn you away? This is an important question we have to consider, and one we don't know yet. And finally, we looked at patient privacy and data ethics, especially when it comes to HIPAA. We know that HIPAA protects sensitive patient health information from being disclosed without the patient consent or knowledge. Therefore, we need patient opt-in to basically train these models in the first place.
So the basic notion here is we're going to use AI technology to put healthcare back in the hands of people and patients.
Therefore, for our recommendation, we recommend investing in clerical and administrative AI technologies such as a bridge to alleviate physician burnout, improve patient experience, and of course, optimize costs. Additionally, we want to invest in deep learning AI technologies that can bolster and improve telemedicine and virtual health experiences of underrepresented patients, a remedial means to some of private equity's past wrongs, and also what we believe to be an untapped option for future growth. Thank you. These are works cited.
You guys ready for your three-part question?
Yeah.
Okay. First part, why is there algorithmic bias in healthcare data sets? What are the potential consequences of algorithmic bias in healthcare? How can fairness be established in healthcare with generative AI such as ChatGPT by utilizing the open science approach?
Yeah, so we talked about in our presentation, the first issue when it comes to model bias is basically how the data is sampled. So a big issue is if you're training a model using like an overrepresented population. So we use the example of a data set trained like solely on white patients, then applying that to Black patients. So the issue is basically how data is sampled in the first place. And we know that basically like in the 1960s, for example, like healthcare, men and women were basically like on like the same metrics for health data. The same nowadays is obviously, it's not the case nowadays. So obviously you need to create different models to account for these differences. So the biggest issue when it comes to biases, like I said, is simply just the sampling of data sets.
Now, in terms of the problem that this ends up imposing is, like we talked about earlier with the men and women being in the same data set, is men and women are genetically and biologically different when it comes to assessing healthcare. And those differences exist between different ethnicities based off of past experiences, how you were brought up, maybe diet, predisposed illnesses, and a lot more. So when it comes to actually assessing a healthcare plan to get over some sort of medical illness, it's not the same strategy for every single person. I personally have really bad acne, and well, Adam does not. I have to take medicine for it. He does not. I can't eat chocolate. Maybe he can. But it's different for every single person, and you can't assume that all healthcare is going to fit the same for everyone.
Yeah, so back to the last question, basically, how can we fix this? So once again, we have to go back to how we sample the data. We were thinking that to solve this, you have to just create different models based on different data sets to account for differences in a population. So you'd have a model for a certain demographic, you have another model for a certain demographic. And once again, you have to make sure that these data sets are accurately representing the people that it's going to be predicting, generating an output for. So like I've said it a million times, but the main thing is really just how the data is sampled. And this comes down to, I guess, who's working on these projects, whether you have accurate statisticians. So thank you.
Take a seat. All right. Next up, our representatives from the North region, the Clemson University Tigers.
We have a clicker here as well.
Oh, perfect, thank you.
I'm the timekeeper. I know you already went over the signals, so 2-minute warning, 1-minute warning, I'll stop you. If you wait over there, I'll give you a 30-second warning and then stop you for the question.
Awesome, thank you so much. $1.07 billion, the 2022 evaluation of generative AI in the global healthcare market. And in 10 years,
$21.74 billion is the valuation in 2032.
the numbers don't lie. Generative AI already has and will continue to transform the global healthcare market from the way we know it.
Hi, I'm John Phillips,
And I'm Emma Pareda, and together we make Pareda and Phillips Consulting.
and here we're tasked with showing you how you should invest in generative AI within the healthcare sector.
Today we'll start out by giving you a brief overview on what generative AI is and the global healthcare market. Then we'll take you into our ethical considerations that we made on 3 different areas within the industry before finally making our recommendation on how to invest in the global healthcare market. And then we'll dive into our legal considerations made as well as your investment opportunity before finally showcasing you how your investment will impact the lives of everyday individuals.
Let's start with a broad overview of the healthcare sector. It currently makes up 18.3% of US GDP and will grow to 20% in 10 years, mainly coming from a 5.5% increase in spending on healthcare by Americans each year, and ultimately reaching the number of $7.2 trillion.
Artificial intelligence is going to have a huge impact on the $7.2 trillion in growth, but understanding AI can be a little bit tricky. So let's break it down. One type of artificial intelligence is generative AI, which utilizes machine learning models in order to create new outputs. There are 3 different types of generative AI. The first being an LLM, or large language model. Large language models act somewhat like a brain. And then there are general adversarial networks, or GANs, which are able to create novel images from combining the 2 images like shown above, the crossbreed of a zebra and a horse. And then finally, there's a variational autoencoder, or VAE, which uses encoders and decoders in order to create a unique output, which is shown in the middle.
The most well-known type of generative AI in the last 2 years has been ChatGPT. ChatGPT takes information from all over the internet, whether it be websites, books, or research articles, and boils it down to the most important parts. Then, users input a prompt and get a response, whether this be text, translate something to another language, or something like code for a software engineer. It's quite good at these novel functions, but if you use ChatGPT, you know it suffers from inconsistent and false information, bias, as well as answers you're just not looking for. And this is why we ultimately recommend you do not invest in ChatGPT anywhere within the healthcare sector.
As John had mentioned, ChatGPT derives its information from all over the internet, making its accuracy rate sitting at 20%, while domain-specific large language models have an accuracy rate of 99.7%. Not only that, but domain-specific large language models have the safeguards in place in order to protect users' data, while the GPT model simply does not. In fact, over 100,000 users had their private information leaked all over the dark web simply because GPT did not have these safeguards in place.
When going through our ethical considerations, we identified the key stakeholders. The first being
Community members,
then government authorities,
healthcare entities,
shareholders.
and finally, pharmaceutical developers.
Now, each of these are important as we've come up with 3 different AI investment options, and the first being diagnosis, the next being used for administrative tasks, and the last for drug research and development. Each of these seem like enticing investment options at first, but once you get into the nuances of the ethics for each of them, you find that some are better than others.
Imagine you walk into your doctor's office and you see a robot. If that makes you feel uncomfortable, you're not alone. In fact, 60% of patients said that they would feel uncomfortable if their medical provider relied on generative artificial intelligence within their medical care. This is simply because generative AI is extremely broad. Dr. Tor, an ENT at the University of Kansas Medical Center, said that when using generative AI in medicine, they can't trust hallucinations and we can't trust black boxes, simply because generative AI is too broad in order to make a specific diagnosis. Over 90% of doctors agree that generative AI should not be used as an autonomous diagnostic tool when in the medical industry. This is simply because doctors use intuitive nuance when diagnosing a patient.
Another use is for reducing administrative tasks. There is no doubt that physician burnout is real, with the targeted number of individuals being 124,000 by the year 2030. But those like physicians like Dr. Hitchcock, who's been running a clinical practice since 2015, see the flaws and potential for privacy leaks. Dr. Hitchcock identified that ChatGPT was quite good at its functions, but when he found out that his patients' data could be at risk, he ultimately decided to hire more individuals to work for him to reduce burnout rather than use ChatGPT to solve the problem. Whether you agree or disagree with Dr. Hitchcock, you'll ultimately come to learn that your investment is not the only thing at risk, but also patient privacy data.
The last option we decided to consider was utilizing generative AI within the drug research and development process. The drug R&D process is an extremely innovative sector within the healthcare industry. In fact, Dave Johnson, the chief AI and data officer at Moderna, said that once Moderna was able to utilize generative artificial intelligence within their COVID vaccine trials, they were able to capture information and make predictions like no other. Not only that, but utilizing generative AI within the drug R&D process is going to shave down the timeline by 2 years by the year 2030. And ultimately, that is why we recommend your firm to invest in domain-specific LLMs that target drug research and development.
Now, let's go through the timeline of drug research and development. The saying time is money could not be any more applicable than in the process. In all these 5 stages, it adds up to an average process of 10 to 17 years. And by investing in just one of these stages, you could save not only time, but money as well.
There are 4 different legal considerations we made when ultimately coming up with our recommendation. The first being the AI Bill of Rights. Then we go into HIPAA compliancy laws, FDA regulations, and European Union regulations.
The first of these is the AI Bill of Rights, which was come up with the White House Office of Science and Tech Policy. Although they've not released it and it is not effective now, it could be in the future. The good thing is domain-specific LLMs are a safe and effective system, and due to the specific nature of the scientific data, there is no risk for discrimination and data privacy is protected. Also, there would have to be notice and explanation to the FDA before the product is approved because of the heavily regulated scientific process. And lastly, humans would still be a part of the drug approval process, but we would be able to cut down on the amount of humans using clinical trials with the use of AI.
HIPAA compliances were put in place in order to safeguard patient data. And given the new field of generative AI, these general policies are going to have to become more specific. But good news for us, our recommendation is able to abide by each and every one of these policies, simply because the data that is collected within the drug R&D process is non-identifying and non-specific. Therefore, we would not only be in compliance, but it would ensure that any other new HIPAA regulations that would be put in place would ensure that our regulation abides by them.
The next is FDA regulations, which in the future would use the framework that's used for medical devices. It's broken down to 3 classes. Class 1, which is low risk. On the other end is Class 3, which is high risk. Where we would fall into is Class 2, which is moderate risk, where patient life is not at risk, with some systems like diagnostic imaging systems.
Back in 2018, the European Union passed the GDPR, better known as the General Data Protection and Regulation Act, which is the toughest privacy and security act in the world. And our recommendation is able to pass this regulation. Although it is considered high risk to utilize generative AI within the drug R&D process, as long as we were to register our products within the EU database and make sure that we're abiding by the product safety legislation, we would still be able to pass the GDPR. Therefore, any rules that the federal government will be able to make, we would be abiding by them.
Next is a broad overview of the healthcare industry with generative AI. It would ultimately lead to $200 to $360 billion in cost saving and an additional $320 billion in revenue. We came up with 3 companies to invest in that we're going to explain further.
The SWOT matrix is what we use, which goes into strengths, weaknesses, and opportunities and threats.
Our first company is Atomwise. Atomwise uses its AtomNet technology to find undruggable targets and outsource it to other companies.
Atomwise was valued at $492 to $738 million. However, one area where they fall short is that they do only target one broad area of the R&D process.
However, there's a major opportunity for potential growth as shown by Pfizer's head of AI. But the weakness is that there's growing competitors with the investment coming in. The next is Deep Genomics. Deep Genomics uses DNA and RNA technology rather than large molecular compounds.
Deep Genomics was valued at $50 million. However, they are somewhat slow when it comes to the R&D process.
However, DNA and RNA technology are improving each year as shown by the market caps. The main threat, though, is that some people do not trust this technology. Our last company is in silico medicine.
In silico medicine does a great job of showcasing the different ways that they're able to use generative AI in the process. One of their strengths is that they have a 99% cost savings from target validation to candidate hypothesis. However, they do require much human capital.
However, their doubling the approval rate will lead to additional $70 billion in valuation. But there is also a threat of multinational regulation.
Idiopathic pulmonary fibrosis, a respiratory illness that affects 207,000 Americans. One of those being Tom Frey, a 9/11 first responder. Tom explains in an interview that during his diagnosis, he not only encountered and realized that the debris and smoke encountered during these attacks is what ultimately led to not only cancer diagnosis, but IPF as well.
Thank you. We're now open to questions.
All right. Ready for your questions? Here we go.
This is a three-part question. First, why is there algorithmic bias in healthcare data sets? Second, what are the potential consequences of algorithmic bias in healthcare? And third, how can fairness be established in healthcare with generative AI such as ChatGPT by utilizing the open science approach?
So most of the bias is coming from the data sets that have different patients from all over the country. Each patient is different, and you have to require specific nuances when doctors are talking to their patients to get a better recommendation. This ultimately cannot be done by a computer that's just taking in information and spitting it back out. However, Emma will explain how you can improve this.
One of the main ways that we can prove these biases is by using domain-specific large language models that specifically target and use non-identifying and non-specific data, simply because that is one of the ways that we'll be able to close in on these biases and ensure that they don't affect doctors and more specifically researchers throughout the research and development process.
The companies that we focus on use molecular compounds as the data that they're using in their products. This does not have bias in it. However, to improve it in the future for more chatbot functions, we think that you should use, to improve it better for the chatbot functions with Open Science Pros, we think you should use more open source models rather than closed source. This is where the code that's in the algorithm is actually present to anyone who wants to use it and can go out and find it, rather than closed source, which is behind closed doors and no one can see.
Thank you.
All right, thank you, Clemson University. Mass exodus. Okay, our fourth and penultimate team from the West region, University of Texas Longhorns.
We have a clicker for you guys. I'm the timekeeper. I'll give you a 2-minute warning, a 1-minute warning. Stop at 10 for both of us. 1 minute for both of us. Yeah. You gotta pass it, and then I'll give you a 30-second for the 2-minute question.
So we asked ChatGPT whether it is ethical. And obviously, I won't read all of this, but the highlights are that it mentioned that it doesn't possess any ethical values. However, it lies in the user of this data in determining what is ethical. And we want to preface our presentation with this because we want to stress investments in companies that are ethical throughout all verticals, horizontals, as well as within each stakeholder. Hi, my name is Tanya, and this is Sneha, and we're going to talk about generative AI in healthcare. So this is our agenda for today.
We wanted to make sure that all of our applications were ethical in the healthcare and AI space. So we looked at the 6 core principles that the World Health Organization designed, and we're going to apply these in our presentation. So these are the 6 stakeholders that we considered, and these are our 3 applications. We'll get right into it. Our first application is drug discovery. And so the problems in this area are it takes over $2 billion to produce a drug, and it takes over 10 years to come up with it. And so our application will help stakeholders in big pharma, providers, and patients. And so our application is for generative AI to get data about genomes and chemical compounds to help researchers come up with a better drug and help them come up with better chemical compositions. So the stakeholders, it will affect big pharma, it'll help them reduce costs and save time. It'll also help providers by offering better care to their patients. And for the patients, it'll be cheaper drugs because the cost to produce them would have decreased. So in the economy, it will help save costs of $28 billion each year, and this is a $50 billion market. And legal issues that might arise are patent eligibility and who has ownership of the AI-generated inventions, and then also liability in case of adverse effects. We conducted a survey of over 100 healthcare consumers to get an understanding of what they thought were ethical considerations in this application. And so 1 being the lowest concern and 5 being the highest concern, we got an average of 2.86 out of 5 concern for drug discovery. We also asked our survey participants to what are their 3 biggest ethical issues that they have with this space, and they said data privacy and security of personal information, bias and unrepresentative data, and overdependence on AI.
So getting into exactly what these ethical implications are, the number 1 is biased data. So obviously you're going to have underrepresented populations that may not be represented within this data, so the drug may not be applicable for all of these groups. Safety of personal information is the number 1 too when using AI, in that this information can be misaccessed and misused, and then incorrect therapeutic outcome. Arguably, this is the most dangerous because in the worst case scenario, it could lead to a life lost. So we talked to a professor at our university to get his insights into this application. He said, at the base, there's really no ethical issue. However, he wanted to make sure human checks are in place throughout this whole process. In terms of mitigation, so to mitigate the biased data set, there's a technique called data augmentation, where your data set is in addition to synthetic data to supplement that, and then this increases the quantities so that it isn't trained on any one particular pattern, and it can have patterns that are generalized, as well as increases the diversity of the data set. In terms of safety of personal information, just like the professor mentioned, having a system of checks is really important to make sure that there's human insight and oversight throughout every step of this process. And lastly, for incorrect therapeutic outcome, once again, human verification. Make sure that there are clinically statistical significant trials that supplement what the AI is saying. In terms of potential investments, we identified 3, but we'd like to really highlight the 3rd one because DeepMind, at the core of all of their technology, they really emphasize safety and ethics, and they have a good amount of revenue and a good valuation.
Our second application is matching consumers to health services. And so the problem is a lot of patients do not know about clinical trials or resources that they're eligible for, and a lot of underserved populations do not have access to a lot of free clinics and health services. And so this application will help different stakeholders, including medical researchers, providers, patients, the government, and health agencies. So this application is where patients can input some information into the generative AI about their medical history, et cetera, whatever they choose, and then they will be getting a list of curated resources that they're eligible for. So that could be a free clinic in the area, a medical trial if they're eligible for, et cetera. So stakeholders that this will affect are patients because it'll help them find out about more resources that they are eligible for. And then health clinics and governments will have an increased turnout at their clinics and things like that. And then medical researchers will also get increased patients for their clinical trials. So this will help the economy by increasing the usage of hospitals and their clinical services, and this will also stimulate research. Legal implications are patient information being shared to AI, and then also, again, misinformation and liabilities in cases of errors. Again, we did the survey, and we got a 2.81 out of 5 ethical concern, which is lower than drug discovery. And then the top 3 ethical concerns were bias and unrepresented data, data privacy of a person, and then also errors in outcome.
So going more into the ethical issues, with errors and outcomes for this one, it could be that the data, the algorithm incorrectly assesses a patient data and matches them incorrectly to a service. That's actually not really useful for them. In terms of safety of personal information, once again, misaccessing and misusing this data. And lastly, for bias, this one's interesting because the algorithm could incorrectly assess demographic information and assign it to certain conditions or treatments that really aren't applicable. And once again, the professor mentioned a system of checks and human verification to validate that this individual actually needs the service. For mitigations for errors and outcomes, we really want to stress the quality of the data in the training. So to make sure that the data is trained on medical research and any sort of historical trends that are verified by the overall medical community, and to make sure that there's equal representation geographically and demographically. In terms of safety of personal information, access control, making sure that each stakeholder only gets as much information as they absolutely need as opposed to what they want. And then in terms of bias, once again, prioritizing that data collection and quantity, and also advertising efforts to niche your areas to increase the representation of those medical services in smaller areas. And potential investments are these two companies up on the screen. The one that we really want to highlight is Informatica because they have a 94% accuracy with their model. They have quite a few patient cases and a lot of successful checkups.
Our third application is health education. So a lot of problems in this area are a lot of med school students spend a lot of time studying versus actually getting hands-on practical training. And there's also a CME requirement that health professionals have to do to keep up to date on their medical knowledge as a professional. So our application will help providers as well as patients. So this application is where health professionals or students can input into the AI different topics that they want to study on, whether it's up-to-date topics or things that they're learning in their med school classes. And then the AI will give them flashcards or different study resources that they can use to stay up to date. So the stakeholders are providers and health institutions because they'll help them offer better quality care for their patients, and patients will in turn get a better quality care. This is a $99.89 billion market, and because of the decrease in time used and money savings, this will stimulate more people in healthcare and medicine and more health professionals in general, and this will stimulate the economy. Legal implications are the CME and licensing requirements, making sure that they're up to date with AI standards, and then also misinformation and errors and outcomes, those kinds of liabilities as well. So we asked the same question and we got a 2.89 out of 5 ethical concern, and the top 3 ethical concerns are overdependence on AI, misinformation, and errors and outcomes.
So to get deeper into this, we really want to stress the overdependence on AI, which is different than the other applications. So in this case, a consumer of this application might completely rely on the algorithm as opposed to getting other inputs from other resources, like other professionals going to conferences. They might just use this AI and call it a day, basically. And then once again, we have the misinformation and errors and outcomes, and that if the data is not trained in the correct way, the AI could respond incorrectly to questions that a student or a professional is asking, and then therefore these individuals are learning incorrect things. And lastly, once again, patient privacy. If an individual, like a healthcare provider or a student, enters sensitive information about another patient or someone that they're asking or trying to identify answers to, that could be a problem. And once again, the professor mentioned for this that human checks are really important, and also that this could result in a cookie cutter approach, which what he thinks could result in the dehumanization of healthcare, which is obviously at the core, healthcare is a very human industry. In terms of mitigations for the overdependence on AI, we really want to stress encouraging other resources. So making sure that the chatbot offers other resources that an individual can go to, other conferences, other videos or anything, and that these are mentioned whenever they ask a question. In terms of misinformation, we really want to stress the training and monitoring of the data, making sure that the data is up to date and trained. ChatGPT obviously is trained up until 2021. We want to make sure that this is trained continuously and is obviously up to date with the year that we're in, which is 2023. And in terms of patient privacy, really having an outlined and comprehensive guidelines of use, encouraging professionals and students not to put in this information and saying that it will not accept this information or store it anywhere. And in terms of potential investments, these are 2 of the following. They're pretty equal in terms of like revenue. They're not one stands out over the other. They're both pretty good.
So again, our 3 applications are drug discovery, matching consumers to healthcare, and health education. So our timeline for investing is health education in the next year, investing in drug discovery in the next 2 to 5 years, and investing in matching patients to resources in the next 5 to 8 years.
And lastly, for next steps, thank you. We're open to any questions.
Ready for your questions?
This is a three-part question. First, why is there algorithmic bias in healthcare data sets? Second, what are the potential consequences of algorithmic bias in healthcare? And third, how can fairness be established in healthcare with generative AI, such as ChatGPT, by utilizing the open science approach?
So getting to the first question, obviously there could be problems in the data if there isn't enough geographic or demographic representation, if the data isn't trained on up-to-date and verified sources by the whole medical community, as we mentioned in the presentation.
Some consequences that could happen if the data is biased is that there's not enough representation in the data. So for example, in drug discovery, if there's not represented data of all populations, maybe the drug will not work for the entire population. It could have adverse effects for some people. And so this could happen, things like that, or different resources. If certain populations are not getting to know about resources that are available to them, it's not in the data set, and that would also be a potential consequence of that.
And to be able to leverage OpenAI's open source, open source, it's really important to get a lot of data from all sorts of research, from all different types of professionals in different fields within medicine. Obviously, medicine is really wide. There's psychology, there's sociology, there's all sorts of stuff. So making sure all of that's represented within, making sure all of that's represented within the data, and also getting data from other research articles that people may have written, and making sure that those articles are verified by other professionals within the online area. And then also another technique is the data augmentation, that to make sure that there could be other subsets of data that are more representative than just data that may be available online, because obviously that data can be incomplete, it could be inaccurate, so data augmentation can increase quantity as well as diversity of data. Thank you.
All right, home stretch, we're almost there. Okay, our fifth and final finalist, Washington University in St. Louis.
I'm your guys' timekeeper. I'll give you a 2-minute warning, a 1-minute warning. Yep, display settings, and then I'll cut you off at 10. There's a clicker right there for you. And then I'll give you a 30-second warning for the question, and I'll cut you off at 2 minutes. I'll be right over there. I'll stand up. I'll do it.
Good afternoon, everybody, and thank you so much for being here. I want to talk to you about an article I recently saw. A mother, Courtney, recently realized that her son, after 3 years, had not received the treatment he needed. Over 3 years, he saw 17 doctors. 17 doctors to try to figure out why he had chronic headaches, why he was imbalanced, why he wasn't growing. But 17 doctors later, there were no solutions. Late one night at the ER, Courtney was desperate. She went on ChatGPT. She had never even used it before, but after making an account, she typed in all of Alex's symptoms. In minutes, she had a diagnosis, tethered cord syndrome. A diagnosis not a single one of the 17 doctors could realize. Courtney and Alex's story is an inspiration to us, an inspiration of the powerful implementation and applications that AI can have in healthcare. However, it also serves as a dark reminder of the gaps in our healthcare system that led Courtney to even have to use AI in the first place. Right now, we see a large gap in the healthcare system, a gap between what is ethical and what is profitable. This raises two major questions. What are the major ethical dilemmas in healthcare, and how can they be addressed by generative AI? And how can these solutions be implemented by private equity firms, keeping in the nature of wanting profitable late-stage investments?
My name is Arushi Ranasaria, and I'm joined here today by Farid Mujahid, and we are both from our consultant at Washington University in St. Louis. So to give you a quick agenda of what we're doing today, we will be given a general landscape of generative AI, and then we will do the same for healthcare before we give our recommendation, and then we will go through an overview of the different considerations and the risks that we have to be aware of. So starting with the generative AI landscape, it is crucial to understand what AI is and how it works. So to give you a quick overview here, we have artificial intelligence, and within that we can find machine learning, deep learning, and generative AI, which is our focus today. If we were to classify these algorithms, we would put them in two categories. The first is generative AI, and that's where AI is used to produce new content based on the data sets that it has already seen. And then we have the predictive AI, and that's where AI is used to forecast predictions and make outcomes based on trends that it has already learned from past data sets and historical data. And we actually have seen that many healthcare companies, healthcare AI companies, have been using these algorithms, and they have seen success. We see on this graph that between 2019 and 2022, AI has seen an increase of investors' interest for generative AI in healthcare, and this is despite the economic slowdown in 2023.
Now let's look at what the main problems in the healthcare landscape are. Right now, our system is built for reactive care, meaning that if you get sick, if your arm starts hurting, you can go see a doctor once you've already identified those symptoms. However, the US is getting sicker and sicker, with 70% of mortality being from chronic illness. Chronic illness can be prevented, but our system needs to change. Luckily, private equity firms have been starting to recognize the opportunity set that lies within healthcare, with investments in medical devices, healthcare services, and health tech. But what exactly does investing into health tech mean?
We have actually identified 4 notable health tech segments. The first here is life sciences, and that's where we're basically thinking about pharmaceuticals, medical devices. And then we have the payers, where the focus is more on healthcare insurance companies, for example. And then we have our government, and they play the role of the regulator here. And finally, the providers, which are the healthcare AI companies themselves.
As you can see, there is a plethora of applications for AI, from administrative tasks to drug discovery. However, our goal of our presentation here today is not to recognize which AI implementation can make the most money or which one is the easiest to implement. We want to recognize what are the issues at the root of our healthcare system, issues that were created by humans. And we need to apply AI here, because if we are not addressing these systematic issues, we are leaving huge ethical gaps in our system. First is the problem of implicit bias. Doctors having stereotypes or not being educated in a certain ethnic group may cause them to not assign critical treatment. There's also the problem of overtreatment and overdiagnosis, where humans are more likely to play it better safe than sorry, a bias that AI may not have. We also see the problem that while chronic illness is rising, the amount of primary care physicians is going to decrease, meaning that there's going to be a shortage between 18,000 to 50,000 primary care physicians by 2034. With AI, we can address this gap, creating AI technology that can predict the onset of chronic illness and create technology that progresses as conditions worsen. Let's take a look at how PE models can utilize this. After all, over 70% of AI funding is early stage. Private equity companies target companies that are profitable and have stable cash flows. So how are they supposed to invest profitably in companies that don't even have positive cash flows yet? The answer has already been started for us. A lot of private equity firms have been increasingly investing in physician practices, with over 500 deals in 2021. PE firms can use this model and acquire healthcare AI companies and use its AI as a tool to increase the service offerings for the firm's primary providers. This means applying high-risk companies and their IP and their technology to your lower-risk investments in private equity, increasing the ethicality and the profits. Let's take a look at a timeline. We have a typical PE timeline here from year 0 to years 3 to 5, where the fund is created, practices are acquired, and the AI technology is applied to these practices, while operational improvements are made both to the AI company and the practices themselves. After years 3 to 5, the generative AI technology is starting to become profitable itself. Improvements in sales continue to be made, and by year 10, all portfolios of companies have been sold. The generative AI company can also be sold for a much higher valuation. Consider it's now profitable, and maybe we can even pursue an IPO. However, no recommendation comes without a plethora of considerations and risks.
That's why, as we continue investing in healthcare AI, it is important to be aware of our different stakeholders and also the risks that may come with such investments. So starting with our healthcare providers here, mainly doctors, nurses, as they use AI in their healthcare provision care, they will be having access to a much more accurate diagnosis. And this will be helpful, especially with rare diseases. As we do so, our patients may be diagnosed for dangerous conditions such as cancer at an early stage, and they can get a much more efficient treatment and a much better recovery process. However, healthcare payers and regulators here might be impacted in a different way because they will have to be on their toes, set the new regulations and new rules that would protect these patients and also meet the need of our healthcare providers.
Looking at economic considerations, there are a lot of applications where AI can be used for cost savings. However, our solution focuses on revenue generation, that these healthcare providers are able to add on an AI service that creates opportunities for people in lower income areas or areas that may not have access to as great preventative care, while also giving the firms a chance to make more profit from these additional services.
A crucial lens here that we have to approach our recommendation from is the legal one. We have to make sure that these companies are HIPAA compliant, mainly to the data security regulations. We also need to make sure that we are aware of any liability of malpractice. Who is the responsible here? Is it the AI? Is it the doctor? And that's why informed consent is crucial. Our patients need to consent to everything we do. However, what's legal is not necessarily ethical, and that's why we have to ensure equity and fairness, and we have to make sure that everyone is aware of their different responsibilities. We also have to be transparent and make sure that these algorithms are understandable by all stakeholders involved. And that's why we always need to make sure that the patient is our #1 priority.
Alex's story serves as a reminder that while the healthcare system has its gaps, AI is the solution. AI has the power to not just look at one person from a singular problem, but from a holistic care perspective. By implementing these solutions, private equity firms have the opportunity to not just be profitable, but to maximize their ethicality. Thank you so much.
Okay, now for your three-part final question.
Okay, three-part question. First, why is there algorithmic bias in healthcare medicines? Second, what are the potential consequences of the algorithmic bias in healthcare? Third, how can fairness be established in healthcare with generative AI such as ChatGPT by utilizing the open science approach?
Okay, so for the first question here, which is why is there bias in healthcare AI? We believe that unfortunately human bias exists, and it's represented in a lot of the data sets that we use to develop these algorithms and these healthcare technologies. So that's why the bias exists. It does not exist simply because we're using AI, but it exists because it exists within the human brain, and it's present in the data sets that we use later on to develop these technologies.
Like Miriam said, unfortunately, there's a lot of historical data that AI is being trained on that represents the bias. Some of these consequences are very similar to what we already see in the healthcare system. People are being overdiagnosed because some ethnic groups may be overdiagnosed for certain issues. On the other end, we may see that certain racial groups are not getting the treatment they usually need, and that can be reflected in the diagnosis through algorithmic bias as well. However, these are issues we've seen in the medical field and will continue to address, and regulators can address this by making data more comprehensive, requiring data to be more public, and requiring people to be more transparent, which leads us to our last question.
For our last question, we believe that an open science approach here is crucial because the more transparent we are, not only with our doctors and healthcare providers, but also with our patients about how exactly their data is being used and how exactly it's used to do not only to find their treatment, but also to diagnose their condition. So the more transparent we are,
the better the treatment we give is, and also the more aware everyone is of how exactly they're involved in their liabilities.
Thank you so much.
Okay, we have just a few more announcements before we get out of here, so sit tight, give us 2 minutes. When we get out of here, judges, I'm going to ask you all to come out this door, and the judges will go to room 120 for deliberations. Participants and coaches, you all can go out into the atrium when we dismiss. We're starting at 5, yeah?
Maybe a little early.
Okay, so hang out in the atrium, coaches and participants. We'll start just as soon as we get the judges' deliberation, and we'll get started with the awards ceremony. So I think Professor Melendez has a few extra words to say.
Well, just a very big thank you to our final group that just presented. A big round of applause to our judges, our field, our incredible student volunteers, their staff. How about a big round of applause? I also just want to thank all of my students that were here today. I hope that you see a little bit of a connection between what we've been talking about in class, especially the business ethics course. And boy, do we have a lot to talk about next week, right? Have a wonderful weekend. I want to wish my students the very best. For all of our judges, please follow us to room 120. For all of our faculty advisors who remain in the field, enjoy. Head on up to the atrium. We'll see you shortly. Thank you. Okay, good.